I've been to Seoul, South Korea once before, and the purpose of my trip this time is to visit LASEROPTEK. And I enjoy it because I get a chance to see lasers that we don't have in the United States and exchange information with LASEROPTEK. I was able to do a tour when I was here before, and then this time I was able to just visit the area around the hotel. So I've done a lot of walking on this trip. I feel very fortunate here in Seoul. It's very, very safe, very clean, and I'm able to walk long distances very easily. I met Dr. Chu in Buenos Aires, Argentina about 10 years ago, and I was there giving a lecture, and LASEROPTEK and Dr. Chu were down there visiting their distributor. And we met, and it was interesting. We met at a doctor's office, and I asked him to see the inside of one of the lasers. And at that point, I'd had a number of lasers that I'd had problems with through the years. And what I wanted to do was to try to find a laser that would be reliable, that was well built, so we wouldn't run into some of the issues that we had run into in the past. And with Dr. Chu, he was able to show me the inside of the device. And at that point, we developed a bond, and we've stayed in touch as friends through the years. And I've been with him from the beginning of LASEROPTEK through developing multiple lasers along the way. In Palm Beach Gardens, where I practice, the average age in that town is about 45, which is relatively young for Florida. Florida is known to have an older population. A majority of our patients are Caucasian, although we have Asians and we have Hispanics and we have darker skin types as well. The majority of our skin types are probably between skin type 1 and 4, but we're able to address any of their needs with all skin types. As far as Palm Beach Gardens go, having a younger population, I think there's a larger desire for cosmetic improvements in their skin, reduction in pigmentation, which has been a major issue with the sun in South Florida. As far as hair goes, I have, along with my business partner, 2 patents for naturally occurring topical DHT blockers. These are products that block the effects of testosterone on the hair follicle. So they work for men and women after menopause. And we've adjusted the formula to work for women before menopause as well. And it's to help people maintain their hair and convert immature hairs to mature hairs to make the hair thicker and fuller. We partnered with a larger company who put it under my name, Shapiro MD. So you'll see Shapiro MD hair products out there, and that's the product line that I helped to develop. Right. Tan skin or sun-exposed skin is a challenge. And it's a challenge with many different devices, including lasers. What I find is that tan skin has activated melanocytes, which are more likely to grab the energy from the laser. So one of the simple tests that I do, I look at somebody's watch tan. If you move their watch and slide it over, you can see how much sun they're actually getting. It's common in Florida for people to think that you have to be at the pool or the ocean to get sun or be at water to get sun, and that's not true. I like to say it's the same sun walking down the street that it is at the beach. So that background sun exposure activates their melanocytes and makes some of the treatments a little bit more difficult in the sense that the active melanocytes want to grab that energy, so it acts like an umbrella, and then the laser beam has trouble penetrating it. So there's a few tricks that I have. Number one is I try to see how much sun they're getting by looking at their watch tan. And if they have a lot of sun, then sometimes I'll postpone a treatment attacking pigmentation. Or another option would be to adjust my energy for that. If the melanocyte wants to absorb more energy, then they're so active, you can drop your energy a little bit and still have appropriate absorption and still treat some of these patients. So my trick is to get a feel for how much sun they've had, how much recent sun they have, how activated their melanocytes have become, and then adjust my treatment accordingly, either reducing my energy a little bit to keep it safe, or in severe cases, delaying the treatment until a more acceptable time. When you talk about aging of the skin, you talk about atrophy of the epidermis, you talk about atrophy of the dermis, thinning of the fat, thinning of the muscles, and this loss of elasticity of the skin. That's what's going on underneath the skin. On the surface, you have photoaging, which refers to pigmentation, benign growths occurring on the surface. So when it comes to treating aging of the skin, you have to approach it from both the inside and the outside. You know, the outside treatments, most of them will attack pigmentation to try to lighten some of the hyperpigmentation that occurs with aging and sun damage. And then on the inside, you have to be able to tighten the tissue. So typically devices like Piccolo Premium you can basically attack the pigmentation on the surface and you can get tightening from underneath. One of my favorite areas to investigate right now is what I call combination therapy. Combination therapy is where you can combine devices at different levels of the skin that have been measured to get that deep tissue tightening, mid-dermal tissue tightening, that tightening just underneath the epidermis, and then at the same time attack the pigmentation that's on the surface. So more recently I've been using infrared laser in combination with Piccolo Premium or the Pico laser in combination with RF microneedling to try to attack and improve the skin from photoaging at all different levels of the skin. Yes, so it's you can do deep dermal remodeling, you can do mid-dermal remodeling, and then you can attack it more superficially, and you can also improve the pigmentation on the outside. So we're working at different levels of the skin, and also to help some of the dyschromia or discoloration that's on the surface. So combination therapy, to me, seems to make more sense and get more of a benefit. So what I've been using is a 1319 laser to go deep into the skin to get some deep tightening. I've been using the Piccolo Premium with the 532 nanometer handpiece to get some more superficial dermal tightening, and then RF microneedling at the dermal epidermal junction to get some improvement in tightening in that area as well. So by working at different levels of the skin, we're able to tighten it. To give an example, acne scarring. Acne scarring may have some deep scars, some more superficial scars, and some discoloration on the surface. So by combining these therapies, we're able to attack all of it instead of just focusing on one part of it in particular. So I like laser optic products because, number one, they're reliable. When I turn them on, I know they're going to work. It's very rare that I ever run into an issue. The second reason is their solid state technology, which goes along with the first reason of being reliable. And then from there, the company's been very responsive. If I were to ever run into an issue, I know I can call them and they'll send somebody out, but again, very, very rare to happen. Over the years, their products over time have become what I call more refined. So when you start off with a laser and then over time, you know the beam will end up being more refined. You know that everything in terms of pulse duration, everything's accurate. A lot of their devices are redirected at the handpiece so that you know when you fire the laser, you're going to get a reliable beam that comes out of there. You know, articulated arms where you have 7 mirrors are complicated. And to know that it's refocused at the handpiece, I know that I've got something that's safe and reliable to treat my patients. So my favorite device from LASEROPTEK right now is a Piccolo Premium. Originally, I was using it to treat tattoos, and now I've realized we can do so much more with it. Seborrheic keratoses or raised freckles, I've just used it to treat small ones, but it works very effectively for that, and that is a very common problem with aging of the skin in South Florida. Other ways that I've been able to use it is for skin tightening. So what I really like about the laser is we started off with one purpose, and now it's become a very versatile laser, so we're able to use it for many different things. And then I have 2 tips. So one of the tips that I mentioned before is the Piccolo Premium plays well with other products, meaning it works well in combination because it's so reliable and you have so much control over the level of the skin that you're treating. So I find that I'm always looking for treatments that work well in combination, that are very, very safe and can be used on the same day. There's different devices that can be alternated. You know, every 4 weeks you've got to do something different. But when I can have multiple devices that I can use on the same day at the same time and end up with something even better, that's what I'm always looking for. And then I still want to do my tips. So my tip for laser optic lasers, and it's lasers in general, is you know, laser optic lasers come with a card that give the energies. And so it's very, very simple to learn how to use the laser, very simple to program the laser. But my tip is always look at the skin. You want to look at the reaction in the skin. So even though a laser may tell you, or a company may tell you for any device how to use it, how that person reacts to it individually is so important. So if there's too much erythema, if there's bruising, if there's other issues, you have to be aware that those can happen when you fire the skin. Sometimes patients will tell you they don't have anything on top of their skin when they do. So that may affect the absorption of a laser. So always looking at the skin to see what the reaction is for that individual patient is one of the most important things you can use when treating patients with lasers.